Heavy chairs.
Good morning. Good morning, and thank you for joining us today. My name is Manny Linares. I'm the CO here at Broward Health Medical Center. Today we are gathered to discuss the near drownings that Broward Health is seeing firsthand across Broward County. It's a tragic topic to discuss, but one that we must address head on if we want to educate our community and help save lives. We're joined today by key partners and lifesavers, including representatives from Fort Lauderdale Fire Rescue, Fort Lauderdale Police, and members of our own Broward Health clinical team, including nurses and doctors from across several departments. How about a round of applause for those individuals? I'm very proud to be the leader of a hospital that provides comprehensive pediatric care for the children in our community. As a level 1 trauma center, I am privileged to witness firsthand the amazing efforts of our dedicated medical team and the emergency department and trauma bay to the operating room and pediatric floors. But that isn't always possible. That's why we're here today. We're here to educate and to do everything that we can to prevent drowning tragedies before they happen. And now to talk about 2 near drowning incidences that occurred just within less than a month from each other is Fire Chief of Fire Rescue, Fort Lauderdale Fire Rescue, Stephen Golan. Steve.
So good morning, everyone, and thank you, Manny, for the introduction there. I also want to thank the families and the heroes for coming out here today. It takes a lot of courage to relive what they've experienced, but it's so incredibly important, not only for the closure of just all of us, but also to educate the community the importance of learning how to swim. Unfortunately, we see way too many of these incidents per year down here in Fort Lauderdale, and it's completely preventable with the right education and getting to the right location. So today I'm going to go over 2 incidents that recently occurred, and then introduce some amazing people that rose to the occasion. On May 10th, just after 3 p.m., our department was dispatched to a report of a drowning at an apartment complex in the 1400 block of North Dixie Highway. This is the type of call that you never want to hear come over the radio, and it's an all hands on deck. Between Fort Lauderdale PD and Fort Lauderdale Fire, all units are responding to this call to see who can get there first and perform those life-saving measures. Our crews arrived on scene in just under 4 minutes, and upon arrival, found Tricia Meinhard and Madison Martin, who were both seated with me today, performing CPR on 4-year-old Destiny. Destiny had been pulled from the pool by her big brother, Christopher, whom's also here with us today. They had already managed to get her heart beating again, and although she was alive, she was still lethargic from what she had just experienced. With the help of Fort Lauderdale PD, we secured all of the intersections and immediately transported Destiny to Broward Health in less than 12 minutes, where she was turned over to the amazing staff. The second incident is on June 4th with a 6-year-old male. We received another call for a report of a child that had drowned in a pool. This time, a 6-year-old male had fallen into the pool at a building, and the parent that was with the child was unable to swim. The building maintenance worker, Campo Caldron, is that correct? Yes. Was immediately jumped in the pool and pulled the young man from the water. CPR had immediately began, and upon arrival, Fort Lauderdale PD, they took over CPR. Our units arrived a short time later, where PD transferred the child's care over to the rescue, immediately secured all the intersections between the residence address, the condo, and Broward Health, and immediately transported. This situation, we were able to transport the child within 10 minutes to get him on scene here with Dr. Amador and his amazing staff. I'm happy to report that in both of these situations, there was a positive outcome, and both children were able to leave the hospital with negative neurodeficits. And as we can see, Destiny here today, if that doesn't bring a smile to your face, I don't know what does. But it's completely preventable. And as a community, we need to come together. We need to help each other and provide the education so that we don't get to that point where we have to go through all of these steps. So with that, I'm going to turn it over to Madison and Tricia so they can share their story.
Good morning, everyone. I'll start off a little bit, and then I'll let Madison take over, because she really drove the CPR for Destiny. And so it was Mother's Day weekend, and we had spent all day at Peanut Island, and we decided to just, something told us to go. We were shopping and doing things. We had a little bit more time, and we thought something just kept telling us, let's just go back to the pool. So we went back to the pool. And Christopher and his friends were playing outside. Sweaty boys wanted to jump in real quick just to take a dip to cool off. And we were in the pool, and our back was turned because they were boys. He was splashing, and he kept checking on his sister, and she was sitting there being so good. So silent, so quick, and to this day, I keep thinking, what could we have done to prevent that? And we turned our back, which I never do as a mom. I'm a mother of 8, and I never turned my back on a child near water, and I did that day. And so, but my daughter Madison, Christopher, I'll let her tell the part about Christopher and then how we took it from there.
So like my mom said, our backs were unfortunately turned to the kids, and Christopher, I heard him scream, Destiny, but I could tell the way he screamed her name, something was not right, and he flew, like literally flew over me into the middle of the pool like Superman. And he picked her up, he got her out of the water, and you know, we didn't really have any type of pulse or responsiveness, so he also helped me give her CPR. It was not just me. He helped me give her breaths, and for a 12-year-old, that's a lot. So he really is amazing and deserves just as much credit as my mom and I, because without him, things could have also gone a lot differently. So it was amazing, and I'm glad that he was there to help us, but I just never, ever, ever will turn my back on a kid ever again in water. Even if it's not mine, I don't have kids, but I'm an aunt and I'm a sibling, so I try to pay attention, but you know, this literally happened within 2 minutes, so you cannot think that it won't happen to you or other people are watching or paying attention, because we aren't. Sometimes, you know, little things can distract us, and that's the outcome of being distracted. But I am glad that she's okay and she's happy and she's healthy, and everyone also give a good shout out to Christopher, because as a kid, that is a lot to have to go through and witness, especially on your own sister. So I would just also want to thank him for being brave that day.
And it happened so fast. I mean, we did not have our backs turned, not even a minute and a half, 2 minutes maybe, tops, and it happened very quickly. And I asked if there was an AED around. Nobody in I helped Madison finish CPR, and she had no pulse. Her tongue was hanging out. Her lips were purple. I mean, and when Madison she was really driving it, telling us, counting compressions, telling her what to do. And when we would say, somebody help us do this, someone go to the door to let the rescue in, because it's a locked gate. Everyone was just standing there looking at us. So we had to assign people to go do something, because everyone was afraid. So luckily, she's a CNA that participates in rapid response at work, so she was able to just kind of help guide that. So very proud mom on Mother's Day weekend, and I will never forget and have a bond forever with this mom.
Morning, everyone. So I just want to thank God for giving me the knowledge that whatever I need to do this, for me, was really traumatic. So I just working that day normally, like normal work day. So I was going to the restroom, and I heard a kid screaming, but like, at the beginning I thought maybe they're just playing, but I felt something in me, and I said, that is not normal. So I went like to see what's going on, and I saw a kid under the water, like completely like a doll, lost, just like he can even move. So I just thought and removed my shoes because I said I don't gonna swim with shoes. So I just removed my shoes. I jumped to the pool. I put it like I could. I put it out of the pool, and then I just started doing CPRs. I don't know how I did that because I was so scared, so I don't know, blocked. I started screaming for help to someone to call 911 because I just throw whatever I have in my hands, and then no one showed it because it was, I guess, so many noises. And then I saw a worker also. I called him. I just called 911. Called 911, and he called to the 911. And what I heard the kid, he wasn't breathing at the beginning, and when I started doing the CPR, he started breathing, and that's when my friend said, "Oh, just talk to the police, talk to 911 because I don't speak English." So I talked to the police. I can even like right now I'm like very nervous, but at the moment I barely can talk because I was out of breath, and even I can give the address. But I just, like I said, I want to thank God for giving me the power to do this. And I just want to say something in Spanish. Para toda mi comunidad, por favor, no confiemos, dejemos solo a nuestros niños, porque son niños. Cuando vean el video, si es que lo pueden ver, van a ver que los niños estaban jugando. Brincó sobre un salvavidas, se resbaló y no sabía nadar. Es muy importante que los niños enseñarles a nadar, porque eso fue el error de ellos. O sea, se cayó el otro niño, no pudo hacer nada para ayudarlo porque tampoco sabía nadar. Estaba aterrado el otro niño. O sea, para mí, si para mí fue traumático, yo no quiero pensar cómo se sentía el otro niño. Pero gracias a Dios y al Fire Department, I want to thank you, to the police, to the fire department, because they came like really fast, and without them, I don't know, maybe the kid was there. Thank you.
Think the word hero when we try to visualize what a hero looks like. We often have the misconception that it's someone wearing a police officer's uniform or a firefighter's uniform. The realization is that we're highly trained and go through years and years and have experience to mitigate the type of emergencies that we're responding to. The true definition of hero is the individuals here and Christopher who don't have that training, who in a moment's notice step up and rise to the occasion, and through their efforts save a life, which we see here today. We'd like to take a minute and not only applaud you, but also provide you with a life-saving award for what you all did, so that you always remember that on this day that the difference that you made, and that it takes a community to come together. So I applaud you. Yeah, we'll do the certificates real quick and then. Okay. What do you think? Can I make a firefighter out of you? This is the beginning? Okay. There you go. now Dr. Amador is going to go over some different life-saving techniques in drowning prevention.
Thank you, Chief Roland. Good morning, everybody. We would like to say welcome back to our dear Destiny and her brother, Christopher, who was so important in saving this kid's life. And also, we're very proud of all the first responders, bystanders, and our team at Broward Medical Center in their duty on saving this beautiful baby's life. It was a team effort. One thing that I will tell you is, in my 30 years of experience working in the PCR, we all know that the only thing that will stop us from working in the emergency room is hearing fire rescue saying we're bringing a kid drowning. That's the only thing that brings fears to our heart because we know what's at hand. Unfortunately, according to the new CDC report released on May 2024, that death by drowning in USA are increasing. And I'm going to bring you some sobering statistics. The number one cause of death in the age group of 1 to 4 years of age is, as you guess, drowning. In the age group of 5 to 12 years of age, the second cause of death is drowning, second only to MBAs. USA has 4,000 drowning deaths per year. That's 11 deaths per day. Near drowning, 8,000 per year, which is 22 per day. Autistic kids tend to have 160 chance more of drowning than a regular kid. There is a racial disparity on the statistic that is very sobering too. 36% of black adults reported not knowing how to swim. So that brings us plenty of opportunity in the community to help them prevent disasters. So, like I said before, in just the summer of 2024, we treated nearly 20 near drownings. 3 of them unfortunately died between the Broward Health Coral Spring and Broward Health Medical Centers to drowning, and each tragedy to the family and our care teams affect us all. As healthcare providers, we treat these children, we share the pain every time a preventable drowning or a near drowning crosses our emergency room. But we also know what things works to save life. Number one, bystanders doing CPR promptly, and children learning how to swim. Near drowning requires immediate and intense and urgent intervention that is often physically and emotionally taxing. Later, after this press conference, a body camera video will be released by the Fort Lauderdale Fire Rescue MPD, and you will see exactly what we mean by seconds count. Also, victims of near drowning who survive can remain with serious complications like pneumonia, acute respiratory distress syndrome, chemical imbalances, IV brain damages that can be neurologically permanent. Also, at our Broward Health and Fort Hospital and more than 50 outpatient locations, we offer this educational flyer I would like to show you here with plenty of education on how to reach to learn CPR and swimming classes across the county. Also has some very useful data of how to do CPR promptly, and I'm gonna share this. It's better to do bad CPR than no CPR at all. And I'm gonna summarize it for people who are looking at this because, like Ivan did, you don't have to know, it's just a response. You know that the brain needs oxygen and blood and flow to the brain in order to save the kid's life. Kids are very resilient. It's really difficult for a kid to die, trust me. But you have to give them a chance. So CPR is extremely important. Most important part is giving to rescue breath, do chest compression. I'm gonna summarize it. If it's an infant less than 1 year old, use 2 finger tips on the lower part of the sternum, which is the bone in the center of the chest, and compress deep. If it's older than that, use the heel of the hand on the sternum, lower part, compress 2 inches down to rescue breath. If it's older, use your heel, hand on top, compress, and you want to have a rate of 15 compression to rescue breath. Try to do it promptly. Try to pinch the nose so the air doesn't escape the nose. And in an infant, you can cover it with your mouth, the nose, and the mouth. So I think in a summary, that's your CPR, but I encourage you to take a professional class with the expert. Second, what is the most important part is when a kid is drowning, the most important part of survival is what this gentleman did here, is what happened at the scene of the crime, so to speak. Whatever is done at the pool or at the beach is what determines the outcome of the patient. It's not the emergency room. Because when we see the kid coming, if we know the condition the patient is, we pretty much know how it's gonna be. But if the kid is already talking, not intubated, and he is as good color, the bystander did the perfect job. And that's what we want to do. We want to quickly remove the person from the water. We want to call 911, put it on speaker mode, and start beginning CPR immediately. And that makes a difference in the work that we're going to do in the emergency room. What's the number one cause of cardiac arrest in kids? Low oxygenation. That's exactly what near drowning and drowning do. The patients start floating. They stop the breathing. That's an automatic reflex called the gag reflex. It's a diving reflex that is very patent on little kids. But after a while, 2 or 3 minutes, when the kid's floating, that reflex releases. The kid starts swallowing water, and that's when they start sinking. And that's when the hypoxemia and the low oxygen start affecting the brain. That's why CPR increases the flow of the blood and oxygen to the brain, and that's what we want to prevent. Like I said before, here are different places where you can call, and there's some coupons that you can scan. One is for the Water Smart Broward, and the other one, every child's a swimmer. And it has different requirements, but by tapping into this, you can get free classes in CPR. Also for CPR, you can tap into American Heart Association, American Red Cross, Broward Health, and Coral Springs Regional Institute of Public Safety. Very important, among the resources listed here in the flyer, Broward Health Coral Springs is the one who offers in-person CPR classes. And these classes not only prepare for drowning, but also for life emergencies that can happen, cardiac arrest, and other life-threatening situations. Very important, when you start having this nice summer with little ones, and you're near a body of water, and you know that Florida is surrounded by water inside and outside, you have to pay close attention to those kids who know how to swim and do not know how to swim. So the safety tips that we have for swimming will be keep an arm's length on your child. If you cannot touch your child, you're too far away. It happened to me. So supervise children all the time near the water. Keep the pool areas clear of toys and items because kids were gonna grab the ball that is floating over there. And if he's unsupervised, trust me, the kid will end up in the pool. Install multiple barriers, 4 side pool fences with self-closing gates, alarms that chimes will open the door, also latches on the door, lock the door all the time, ensure that non-swimmer wear life jacket, not the little floaties, and immediately, if the kid goes missing, go straight to the pool. Chances are the kid's gonna be there. If he's outside in the street, so be it. But start heading to the pool because the chances are the kid is inside the pool. Right now, this time, we will have to take a question from the media. No, so that's the beauty of this place. This is why I like this place. This place works like a clockwork. So the first thing that happens is fire rescue gave us an update of the age. That automatically start us thinking of what potential equipment, medication, and personnel we need at a particular moment. So we start preparing the equipment based on the age of the group, and therefore the weight and the medication we potentially may have. We call respiratory, we set up the room, usually it's room number 5, that's our resuscitation room, and we have all the equipment prepared for the worst. If the patient appears to be stable and there's not major things to be done, we call it a day, we do X-ray, we do lab work, and we determine the severity of the drowning. If the patient is in a full code, then that's when we had to get going. So we have to start intraosseous access or IV fluids, resuscitation, epinephrine, sedation, anesthesia, X-rays. Anything else will be available at that particular moment, ready for the patient. So usually level 2 is for traumas. And again, there's a fine line because you don't know if the patient injured his head there's a fine line between the trauma and a simple near drowning. A near drowning doesn't apply to a trauma, but if it's an unknown situation where we don't know if there was a diving accident, you will have to consider that a potential trauma to the C-spine and or to the head that caused the drowning. So if you don't know exactly how it's a mechanism, they might call it a trauma and run it like a trauma, not like a medical emergency. So in my experience, usually when I hear rescue saying the patient was unaccounted for 2 or 3 minutes, that's a good sign for me in my book. And that's how far the kid will kind of survive floating before the real emergency in the brain happens or cardiorespiratory. Once I start saying 5 minutes or more, I know that we're against a wall. Second, when they say found floating, that's a good sign. When they're saying found at the bottom, that's not a good sign. So everything changes and it has different consequences, but I'll take a 3 minutes versus a 5 minutes. I'll take a floater versus a bottom one. That changed completely everything. En español. Siempre que escuchamos la historia de alguien que viene por rescue porque se ha ahogado, siempre preferimos escuchar la historia de que el paciente lo encontraron flotando en el agua, porque eso quiere decir que todavía los pulmones están llenos de aire y existe la posibilidad que todavía esté oxigenando y el corazón sigue latiendo. Pero a medida que el oxígeno baja en el cerebro, todos los reflejos paran y el paciente empieza a tragar agua y va dentro de los pulmones, lo cual lo hace hundirse. Eso toma aproximadamente 4 a 5 minutos. Por lo tanto, nosotros preferimos lidiar con un paciente que viene por rescue, que ha estado flotando, porque eso me dice que lleva 2 o 3 minutos, versus lo encontraron en el fondo de la piscina, lo cual me indica que ha estado más de 4 o 5 minutos, lo cual lo hace un peor caso de sobrevivencia.
Can you explain just kind of what was going through your mind as all of a sudden you're approaching this going, oh my gosh, what do I do? I mean, talk about your mindset and what was top of mind.
Okay. So what was going through my head at first was honestly nothing. When I heard Christopher scream, I could feel something was wrong, but I didn't know what. And when I turned around, she was floating, but I couldn't really tell because of the sun if she was on her back, because some kids do know how to swim and they float on their back. But when I seen Christopher pull her, felt all the blood go to my feet, and I just panicked, really and truly. But I do work at the hospital, so I'm used to, doing things like this, but not with children, adults. So that was a little bit traumatic in that sense. But honestly, all I could think about was it's the day before Mother's Day. The baby has to live. That's the only thing. I was literally crying, giving her CPR, because I just couldn't imagine she comes home and this is it, like that's done. So I'm really thankful that Christopher was there with us to help us and get that handled and taken care of. And then the fire department, he came flying in, like literally I think there was dust behind him. So that felt like the biggest relief ever. But it was very, very traumatic. Even for somebody in healthcare, that was not something I was expecting to see or deal with. But I'm thankful everything turned out the way that it did. I'm a CNA, yes.
Parents, the importance of learning to swim in South Florida at an early age, and then the benefit of anyone taking a CPR course in case they find themselves in it.
The question was in regards to the importance of preparation for learning how to swim at a young age. I can tell you that children are able to learn how to save themselves in water at 6 months old, before they can even walk. Living in an environment where we have water everywhere, it is incredibly important to make sure that your child is drown-proof. There's all sorts of programs that are out there. There's funding to get the children into these programs. And I would encourage everybody that immediately, before they're even walking, before they're able to get out of your sight, to get them into one of these programs, whether through the YMCA, there's various programs out there. And make sure your child is drown-proof. You know, when you hear the doctor say that the leading cause of death in pediatrics is drowning, and it can be prevented with education. So as a parent, as someone that is here to advocate for my firefighters and for the police officers, it puts all of us through nightmares when we respond to one of these calls. It is truly a call that affects the entire community, and it's something that's completely preventable. So please, please, go online, find the class, and get your child drown-proof. And
On that answer, statistics say that from 1 to 4 years of age, if they know how to swim, if you teach them how to swim, the probability of drowning drops 88%. That alone. Sí. Básicamente está demostrado que si un niño de la edad de 1 a 4 años les enseñan a nadar temprano, la probabilidad de ahogamientos disminuye 88%.
question was in regards to CPR and the importance of CPR. As Dr. Amador had shared, that any CPR is better than no CPR at all. Even if you don't know exactly what you're doing, placing the hands on the chest and beginning the compressions, at least begin to get the blood flowing throughout the body. That's so incredibly important to have an outcome like this, to have negative neurodeficits, to have a child that is going to be able to have an amazing life and is here today with us talking, speaking, and that's because that was started on scene. Our response time in fire rescue and with PD is normally like 4 to 6 minutes for us from the time the 911 call begins until the first arriving unit. That's a very, very long time for a brain to be without any circulation. And a lot of times, if CPR isn't started during that time frame, the outcome is not as favorable. So we encourage everyone, if nothing else, go online. But there are programs through Broward Health, through the city of Fort Lauderdale, through the YMCA, through American Red Cross. Please, please, go online, take one of the classes, because it may be your very own loved one's life that you have to save one day.